Good day. Today is World Health Day. We all know that WHO was established in 1948 and World Health Day is being observed from 1950. And every year there is a theme. This year's theme is Health for All. I was working in the Ministry of Health in the organization Institute of Public Health, and that was a national institute. And I was quite aware of the health situation in Bangladesh. At that time, WHO recruited me in their organization. And I was responsible in different countries to work with the health ministries and see the health conditions and their strategies to improve health. Finally, before my retirement, I was working as a regional advisor in WHO. And in that capacity, I visited all the countries in the region. There were 11 countries. Out of those 11 countries, Thailand had the best healthcare services, and that was more people-focused or public health-focused. And the name of their ministry was also Ministry of Public Health. That impressed me, that influenced me also, so that we can, in Bangladesh, have a public health approach of our healthcare services. For that, I have visited the countries of the region and found all the healthcare systems that are functioning in those countries. In my capacity, though at that time I could not organize any organization in Bangladesh, but I talked to the people who were working in public health, and they were quite agreeable that we must have an organization who will promote public health in Bangladesh. And when I retired from WHO, just before I am back in Bangladesh, I talked with the public health people of Bangladesh. They were quite agreeable. And after my return, I took the initiative with my fellow colleagues to establish this Public Health Foundation of Bangladesh. And that is what is functioning now and quite internationally known. And we have organized different national and international the conferences with different themes, as well as we regularly organize seminars, conferences, and meetings where we always try to promote public health as a sort of a national policy. Though we have to establish a national policy of public health, but we are still working on that so that we can influence our government so that they have a public health policy in their national health policy. Public Health Foundation of Bangladesh is now a member of Southeast Asia Public Health Education Network, CFEN, as well as World Federation for Public Health Associations, that is WAPA. So we are working together in improving public health education as well as other public health activities. A public health approach for healthcare is essential because it is not only in Bangladesh but also in other countries, those who have poorer economy. Why it is essential for Bangladesh? Bangladesh is a poverty-stricken country, and the people of Bangladesh has to, with their out-of-the-pocket expenditure, if I call it, it is one of the highest in the world, that is nearly 70%. So with that, people's affordability for their health, education of their children, as well as other expenses that is necessary, housing, and other required facilities in a family to live is actually curtailed, and which also again affects health, because nutrition is one of the essential things required for our health, for our defense system of our health. So not only Bangladesh, but as I said, the other countries also should give a public health approach to their health. When I say public health approach, there's three components of it. One is we are to keep ourselves away from the diseases. That means we are to prevent diseases, and then we are to cure diseases with medicine, which is expensive, and other necessary investigations and all. And third thing is again a rehabilitation. That means when the person becomes sick, once he's cured, then also there is a time where for the full recovery he needs a rehabilitative period, as well as there are some essential things which needs for rehabilitation. So this is what is covered in public health. There are all the three components to be taken. So in that context, I think prevention is the best. That means it minimizes the health cost of a person. Bangladesh is one of the countries in this region with a minimum health budget. And there are other countries who cannot afford much also. So for all those countries, those whose economy are poor, they should adopt or accept a public health policy, or they should apply a public health policy where their limited resources can be best utilized. Now, how it can be best utilized? If we adopt a policy that we shall improve the situation of health by preventing the diseases, that should be the prime responsibility of public health. So we should have safe food, we should have safe water, and we should also have the body's defense mechanism improved so that we can have a disease-free condition of ourselves. That is the best way. So first is the prevention, as I mentioned. So we are to involve the government, because the main chunk of money is being spent by the government for health. So if we cannot afford more, say, health resources, then the best way of involving population and government should involve the people so that they can improve their health by preventing the disease. So for prevention, whatever necessary, starting from sanitation to safe water, safe food, everything should be done so that we don't suffer from any diseases. So that is the primary responsibility of ourselves as individual as well as the government. So that is what I think should be the priority of the government in their health policy. If we can do that, I think we can improve our national health, as well as we can also see that if every country improves their national health, the total health of the people of the world will be improved. So our Public Health Foundation of Bangladesh is working on that, not only in this country, but also in partnership with other public health foundation organizations or similar organization. So the best approach will be that we people individually do not suffer from any disease. And that can be easily done by taking care of our water, food, so that these are safe, not adulterated or polluted. And the other way is do all those things like good sleep and a timely exercise, as well as take healthy food. These can improve the situation of our health. Public Health Foundation of Bangladesh is working for health for all population of Bangladesh, and we need our people to be a part of us, and if we can involve them with their participation, we can improve the health for the whole population of Bangladesh, as well as we can contribute in world health. The best approach is the disease-free living and the healthy living, and try for that. Thank you so much.